tell me, your name is Kate,
Kate,
correct?
yes.
Okay. All right, Kate. And I'm curious what's bringing you in? What's going on?
Yeah, I've been really struggling, I feel like, for the last, like, year, 2 years with, like, I keep, like, passing out all the time.
Mm-hmm.
And, like, I just feel like I can never, like, settle down, and I'm anxious, and that's just making me, like, I don't know, I just feel like, why even be here if I'm going to just keep going through this? And, like, yeah.
Yeah. And tell me more about, you're not sure why you should be here. Have you had any thoughts of hurting yourself or suicide?
I guess, like, maybe 2 years ago, kind of when this all was, like, getting worse, like, I did attempt suicide twice.
Okay.
And so I was hospitalized for both of those. But I don't know, it's just hard to keep, like, wanting to be here and, like, wanting to be around people when, like, all I feel like I'm doing is just, like, passing out all the time and, like, I don't know, just hard to do anything.
Yeah. So when did your 2 suicide attempts occur?
Yeah, I want to say those were in 2020.
Okay.
And they were both pretty quick after each other. Yeah. Yeah.
Where do you feel like you're at now in terms of that?
I feel like at this point, I don't necessarily know if I want to die anymore. It's hard to be motivated and it's hard to do anything. I just kind of sit in bed all the time because I'm worried I'm going to pass out.
Sure. So sounds like passing out.
Yeah.
In what sounds like in public, around people?
Around people, typically. The first time I passed out was at a football game. I was a varsity cheerleader.
Okay.
And I passed out in front of our whole student section. So, like, just having that and, like, having to be taken away on an ambulance, like, when you're in front of your whole student section, that's pretty humiliating.
Right.
Yeah.
For sure. Yeah, so are you on any medication right now?
So, right now, I feel like the doctors gave me, like, a citalopram.
Oh, yep.
And then, Buspar.
Okay.
But, like, I feel like those kind of helped, like, if I was feeling anxious, like, when I was starting to feel anxious more constantly, but, like, it's not stopping me from passing out.
Oh, okay, so you're still experiencing those symptoms.
Yes, yeah.
Okay, I see. And how about, that feeling of, not wanting to be here, feeling unmotivated? Has that changed since starting medication? Or is that the same?
I feel like if anything, it's gotten worse.
Oh, okay.
I think for me, because, when you're taking medications, you expect it to fix everything, and when it's not, it just kind of makes you feel like I can't do anything, like I'm helpless. Yeah.
For sure. Yeah, so have you had any past mental health issues before? Any past diagnoses?
So, I saw a counselor when this first started in, like, 2015.
Okay.
And, like, I went to, like, 2 sessions, and all she wanted to do with me was work on breathing techniques. So, I didn't really, like, benefit from that. I never really felt like I got a diagnosis either.
Okay.
I was just told, like, oh, you're just anxious, let's work on breathing so that you don't pass out. So, I got the medications from my general health provider.
I see.
Yeah.
And how were those breathing techniques? Were they helpful or not?
I felt like when I was told to do that, it felt like that's just, like, what you do. And I was like, why am my parents paying for me to go to therapy when, like, it's not even helping? And, like, I know to breathe in slowly out my nose and out my mouth, but, like, when I'm literally, like, about to pass out, like, that's not helping.
Right.
Yeah.
For sure. So, I'm curious, have your family experienced any mental health issues in the past or currently?
So, my dad has diagnosed OCPD.
Okay.
And bipolar. My mom says she has OCD, but she's never been to, like, a counselor or a psychologist to get diagnosed.
Okay.
So, like, I'm kind of skeptical about it. She's just very strict about things. So I kind of grew up with that strictness of everything having to be perfect.
Sure.
And then with my dad, like, super mood unstable. Yeah.
Okay. And how was your relationship with each parent?
Yeah, I think, so my parents got divorced 2 years ago. So I think if anything, my relationship's been better with my dad since then. That's also when he went and got those diagnoses.
Okay.
So I was 19 when he got those diagnoses. So me and my dad's relationship is a lot better. He's medicated from it now.
Okay.
My mom and mine's not as strong as my dad's and mine, but it's still good.
Okay.
Yeah.
Yeah. So it sounds like you're pretty content.
Pretty content, yeah.
With both of those relationships? Okay.
Yeah.
Yeah. How's their relationship with each other?
They don't talk.
Okay.
I'm their mediator.
Okay.
Yep.
I see.
Yep.
So, are you in school right now? Are you working?
Yeah, so I am full-time at St. Mary's University to get my LPCC.
Oh, okay.
Yep.
Nice.
And then I'm also a full-time student at Crown University to get my Master's of Divinity.
Okay.
So right now I'm in 24 credits.
That's a lot.
Yeah.
How do you feel like you're handling that?
Surprisingly, I feel like I'm handling it pretty well.
Great,
given everything.
Sure.
I feel like that I really like school, so for me to be like in school this much feels good to me and it feels natural.
Yeah.
Yeah.
And do you ever experience these passing out while you're in school?
During my undergrad I did.
Okay.
So I think under my undergrad there was 6 or 7 times I had to leave the classroom because I was gonna pass out.
So you can tell before it happens?
I feel like I normally get like a 1 to 2 minute window. And it like after that like it's game over.
Yeah.
So yeah.
Tell me what happens in those 1 to 2 minutes.
Yeah, so interesting that you asked. So originally my doctor, because I've been going to my doctor to get this checked out for like, because this has been going on since 2016, right? So my doctor originally thought I had a heart condition.
Okay.
So they actually like hooked me up to like a heart monitor. So like from a biological standpoint, my heart rate was going up to 220 and then dropping to 40.
Okay.
And so, but they ruled that it wasn't any cardiac issue, so I don't have any like diagnosed medical conditions that would explain this. Like my thyroid's fine. They just know this whenever this is happening, my heart rate shoots up and drops down.
Okay.
So, and then after I pass out, I typically like shake a lot and like stuff. So, which I think that's probably more just because I just had passed out, so I'm like freaking out, like I'm on the floor and like sometimes I'll hit my head and stuff like that. But before it happens, I feel like, I don't know, I guess like I worry what other people are thinking sometimes when having this happen, but I don't necessarily know that that's starting it. I don't know, I just feel really anxious before it happens. Yeah.
Have you recognized what it is you're anxious about?
No, and that's why my doctor recommended I come see a counselor for this, because there's nothing medically wrong with me. So, and the only thing I can say, whatever triggers this, and I hate to say triggers because like I can't find a stimulus, so I just feel anxious. Yeah.
Okay. Yeah. So you haven't had any medical diagnoses or medical issues in the past?
So I guess recently, this past February, I did have pancreatitis.
Okay.
But this wouldn't have been related to this, but they did like all this medical testing to see if it was, because at first they thought like I had Ehlers-Danlos or like some other heart stuff, and it should prove not to be any of that stuff.
Sure.
Yeah.
Okay. So that's been ruled out at
Yeah.
this point. Yeah. And so, you mentioned you're going to school double full time. Sounds like.
Yeah.
Are you working while you're in school?
So I was working up until May, and then kind of had a little breakdown and decided that I couldn't work full time and be full time in 2 programs.
Yeah.
Because I worked full time and was in full time school all through college, or my undergrad, and I did it for the past 2 semesters, and then I just got to a point where I just couldn't do it anymore, and so my husband and me made the decision that I would just be a student. So
sure.
Yeah.
Okay. So you're not working at all right now?
I need 2 days a week, but that's it.
Oh, okay.
Yeah.
I see. And what's your work history?
Yeah, so I got my first job when I was 15 at McDonald's, and I've had a couple of jobs, but it was more so, it wasn't because I never liked where I was at, it was just because, like, I got better pay wherever I went.
Yeah.
So I've worked consistently from 15 up until this point. I've never had a break off of work.
Okay. And have you ever experienced any of the anxiety and panic and passing out that you talked about while at work?
Yeah. I think at all my jobs, I've passed out at least 6 or 7 times.
Okay. And what was that like before and after?
Again, kind of those same feelings where anxiousness would come out of nowhere, and then all of a sudden I pass out. So.
Okay.
Yeah.
And did that impact your, job performance, or how, if you stayed at the job or not, things like that?
It wouldn't force me to feel like I had to leave the job, but it definitely came down to like feeling like, do I need accommodations? And that's kind of when I started going through all this medical testing. Because if it was a medical, then you get the accommodations. But like, I don't know. Like, it's hard to explain to an employer like, oh, sometimes I get anxious, so I pass out. Like, so it's not that it's ever hurt my job, but like I don't want it to continue.
Right.
And now that I know it's not a medical thing, and now I'm on medications and nothing's changing, like I want to figure out what this is.
Sure, for sure. And what's your housing situation?
Yeah,
Is it
so
stable?
very stable.
Okay.
Yeah. There was a period of time when my parents were splitting up that like I didn't really have a spot, and my panic, the things kind of got worse. But like, I have stable housing besides that, yeah.
Okay. And are you in a relationship at all, or single?
Yes. I've been with my husband since we were 16, but we got married last year, so we've been together for 8 years.
Okay. And how is that relationship?
Very good.
Okay.
Very good, yeah. He's been a very good supporter of all this, and goes to the hospital with me when I get hospitalized from this, and yeah.
Yeah, how often have you been hospitalized?
So I've gone to the hospital from this 5 times. The first time I ever passed out, they brought me to the hospital because we didn't know what it was or have any idea what was going on. And then the other times have been if I've ever hit my head when I've passed out, or if I've been somewhere where somebody didn't know that I had something because they thought that I was having a seizure.
Yeah.
So.
Sure. So have you had let's see here. Alright, switch gears a little bit.
Yeah.
So do you have any legal history, like, speeding tickets or
Never had a
theft or
speeding
anything on your
ticket.
record?
I have 1 parking ticket I think I ever got.
Okay.
But no legal trouble or anything.
Sure.
I'm a pretty goody 2-shoes.
Yeah. And then any past substance use or current substance use?
So, I don't drink anymore. I stopped drinking after I got pancreatitis. I never drank
Okay.
heavy.
Yeah.
Like, my husband and I love to get rum and coke every once in a while, but the reason I stopped drinking is just because we found out I was allergic to alcohol.
Oh, okay.
But, one substance, I guess the only thing that maybe I would mention is I did, when I was 16, get diagnosed, or I was treated for a laxative abuse, due to some eating issues and abusing laxatives.
Yeah, tell me more about that.
Yeah, I was always the heavier person, and I also dealt with a lot of constipation, to be completely honest. And so my doctor, when I was 15, recommended trying some different laxatives, and I tried them, and I found I was losing weight with it, and so I just couldn't stop taking them. So I was drinking a whole container of Miralax a day for a while, and I lost 50 pounds in a matter of 2 months.
Yeah.
So it kind of started, I guess, when I started passing out. It's after I lost all this weight, I guess. But yeah, I got treatment though for by the doctors that I couldn't take laxatives anymore because my colon was being fried. So.
Okay.
Yeah.
Yeah. And so So you had like multiple reasons why you're taking it. One of them being constipation.
Yeah.
Another one was you like the losing weight.
Yeah, I think
aspect.
the reason I kept taking them was because I was losing weight. Like, I could have really cared less if it was helping my stomach feel better.
Okay.
What, like, made me take as much as I did was because it was the only thing that I felt was working to make me feel better, like, about myself and how I looked.
Yeah.
Yeah.
And have you done anything else to help you lose weight in the past? Like anything like excessive exercise, puking,
So
restricting?
before that, I tried making myself throw up every once in a while before I would eat. Or, like, tried, like, eating only a bag of spinach a day to see if that would help. But, like, they weren't things I could do for a long period of time, and, like, they didn't work the same way the laxatives worked,
Sure.
you know? So, like, the laxatives were, like, easy to take and done, but I haven't taken any laxatives or anything like that now in, like, 3 or 4 years.
Okay.
So, it's been a while since that.
Sure. Did you ever have any past diagnoses with eating disorders?
I don't think I was ever diagnosed with
Okay.
one. I never, like, saw a specialist for it. The only time, like, when I say, like, I got treatment for it was because, like, to be honest, like, one day I went in because I was having bloody stools, and the doctors just said my colon was inflamed, and so I should stop taking laxatives.
Yeah.
And they didn't really ask me how much I was taking. They just said to stop it. But I was actually, like, congratulated of how much weight I lost. So, yeah.
I see. Do you struggle with body image now or recently?
Like, of course I wish I was smaller, but, like, I feel better now where I am at than I did when this was all going on.
Okay.
I think now, like, after college and stuff, like, I started, like, focusing on, like, loving my body more.
Sure.
So, like,
Yeah.
I definitely don't feel like I'm in the wrong body or anything. I just feel like, of course, like most people, like, I want to lose a little weight, but it's nothing excessive, and I now know healthy ways to go about that.
Yeah.
Yeah.
Okay. Sounds good. Do you take anything over the counter right now?
Yeah, I take collagen to help with skin and nails.
Okay.
I take a probiotic because it's like a healthy thing to help with my other gut issues. Other than that, I don't take anything else. Oh, I didn't take a vitamin, I guess, technically, but
Okay.
yeah.
Yeah, sure. Let's see here. Do you feel like between your spouse and, your parents, do you feel like you have a good support system around
yeah.
you? You have friends?
Yeah, I'm really involved in my church too.
Oh, okay.
So that's been a really strong support system for me, and those are the people that were kind of encouraging me to kind of get more seeking for this passing out stuff. So.
Okay. Have you ever passed out in front of them or at church?
I don't think I have actually.
Okay.
Yeah.
So if you can identify where you've passed out, it's happened at work.
At work,
you said.
at school,
At
a
school,
lot. Specifically, it
undergrad.
was in high school a lot. I think when I was passing out the most, probably would have been my freshman year of college, and it was like 3 or 4 times a week.
Okay.
Yep. And sometimes it'd just be in my dorm room. Sometimes it would just be like out when I was working at college or in a class and I had to step out because I just felt like, and like even thinking, I felt like whenever I'd think about passing out, I'd pass out. Like, not that I was like working myself up for it, but like, I don't know, just like when I was anxious about passing out, which made me pass out. Yeah.
It was probably really scary
Yeah.
for you.
Yeah, I feel like for the first 2 years, it was terrifying because we thought like I had epilepsy or I had a brain aneurysm or I was having many strokes, and we did all this testing and nothing came out of it.
Yeah.
And so, and like my parents didn't really believe in mental health, so that's why now as an adult I'm seeking a counselor. They literally the only person that I told you about was like the breathing technique person, and I don't even think that they were a licensed counselor. I think it was just somebody that they wanted me to talk to.
Yeah.
But now at this point, it just feels like it's something that's holding me back and like something I just can't live my life with. Yeah.
Yeah, like it's really impairing
Yeah.
you right now.
Yeah.
Yeah, for sure. Do you happen to know if you walked or talked on time, or, at a developmentally
Oh, yeah.
typical age?
I was ahead on most of those things.
Okay.
Yeah.
Okay. And how's, been making friends for you in the past?
I'm a very social person, yeah. I definitely think that this passing out's kind of stopped me from making friends because I'm worried to go out into social situations, because if I pass out, then I'll be labeled as that person.
Mm.
So I definitely think that's been something that's complicated it, but I normally don't have problems with friends.
Yeah. So are you ever afraid that your friends are gonna judge you because of that when you're out with them?
It's not a judgment thing versus a being labeled as the girl that passes out. Yeah, so I'm not really, it's not like I care what people think. Like, I do care what they think to a general, like, as everybody does, have some cautiousness about other people's opinions.
Yeah.
But I wouldn't say that people's judgments are what's keeping me from going out in public.
Mm-hmm.
But it's definitely a reason I stay in bed, because I'm worried I'm going to pass out, which means I'm worried people are going to think that.
Yeah.
If that makes sense.
Yeah.
Yeah.
That makes sense, for sure. And then, can you tell me more about when you're right before you're passing out? I know you already described some of the things you feel. Are there any other symptoms you feel during those 1 to 2 minutes that you haven't shared with me?
Yeah, I guess I get really sweaty right beforehand.
Okay.
Like, I feel like I'm burning, and I feel like it almost feels like I'm going crazy, or I'm getting manic all of a sudden. Like, I'm like, I don't know what to do, and my thoughts racing, and my heart rate's going up. Sometimes I feel like I'm just gonna die all of a sudden, and then I pass out. So I'm like, oh my gosh, I collapse, and my head spins. I feel super nauseous, normally right before and after. Yeah, I guess it's very physical. Like, I feel like I literally feel like my heart's beating out of my chest. Sometimes I even feel like I can't breathe or I'm choking. And normally it's that point, either the choking or I feel like I'm gonna die, that's right before I pass out.
Yeah. So I'm curious, when you feel anxious in these moments, I know you said you don't feel like you have a trigger for them, and it's more like somatic, bodily symptoms. Did you have anything happen as a child that maybe you experienced panic from? Like, any traumatic experiences that caused panic in you?
So, I mean, yes and no. So, I was assaulted when I was 3.
Okay.
But it's not, I can talk about those things, and that's not all what sets me off. I don't really, I had nightmares for a while about, being raped and all those things, but, I feel like that's not at all what I'm experiencing when I'm experiencing these panicky episodes. I can talk about what happened then and, process that without feeling I'm gonna pass out.
Okay.
Yeah, so I'm very, maybe there's some stuff that I haven't dealt with when I was 3, but, I'm not worried that that's gonna happen to me again, you know? So I feel like, even though that did happen to me, I feel like these are completely separate. Right now I'm talking to you about it, I'm not feeling anxious at all.
Okay.
You know? Yeah.
It's good to know. And I'm curious, have you felt kind of hopeless about your panic? Do you feel like you have any control over it?
I feel like I have no control, and I feel like that hopeless is more helpless.
Okay.
You know, so it's not I'm hopeless that there's nothing that's gonna fix it, but it's not hopeless within myself or in the world. I just feel like I'm helpless in the world, if that makes more sense.
Yeah, no, for sure. Do you ever experience a lot of sadness around this? Or
after I pass out, typically, or I guess other times I do feel sadness is if I ever feel like I can't go to something. Like I mentioned, I'm really social, and so sometimes if I'm like my friends want to go to the mall, I'm I don't know if I can go to the mall because what if I pass out?